Hello and welcome back to GP Video Podcast by Nadia. So today we are still continuing with the weight loss medications, and in the weight loss medications I told you yesterday that we have got 5 options available in Australia. Out of them 2 are oral and 3 are injectables. So out of the oral ones, I'm continuing with Duromine because I started it already, so we'll continue with that today. So let me remind you about what we were talking about, not Ozempic, it's Duromine. So Duromine is the brand name, and the actual name of the medication is called phentermine. It is a psychostimulant like amphetamine. It is used as an appetite suppressant. It's a short-term medication. So it does modulate noradrenergic neurotransmission like psychostimulants, amphetamine psychostimulants, to decrease appetite. However, it has no effect on dopamine pathway, which the other amphetamine psychostimulants have. So there is a decreased potential for abuse. There is still a potential for abuse, but there is decreased potential for it. So basically, psychostimulants are used for the treatment of ADHD because because as the name suggests, they are psychostimulants. So they increase the concentration levels and they increase the energy levels. So Duromine does the same as well, but unlike the amphetamine psychostimulants, it is a short-term medication. It can only be used if it's used daily for up to 3 months. If it is used on alternate days or every third day, it can be used for up to 6 months. But then you have to come off it for a few months to give your body a bit of break because it can have serious side effects after that. And then you can restart if needed. But ideally, it's a short-term medication. As I said, it's an oral medication. It's an appetite suppressant. It is approved for weight loss in Australia, but it is a private script, and it comes in 3 strengths. 15 milligram, we start with 15 milligram, has to be taken early in the morning with breakfast. Otherwise, it will make you insomniac at night. Then we go up to 30 milligram. Then we go up to 40 milligram. You can stay on 15 milligram if it's working for you, but again, even if you do 15, 40, 30 or 40, it has to be for 3 months, and then you have to give your body a bit of break. Suppresses appetite, as I said, usually for people for BMI or body mass index more than 30. It's combined with a resin which slowly releases it. So this medication phentermine is combined with a product which slowly releases it so that it is effective for the 24 hours. It is a bit expensive. The price ranges anywhere from $80 to $150, especially depending on the brand. So if you're going for a generic brand, it's usually the cheapest. If you're going for Duromine or the other brands, then it's of course more expensive. And again, 15 milligram is the cheapest and 40 milligram is the highest or the most expensive. So these were the few things, and I'll tell you a few more things today as well about it. A few other things that I would like to tell you today is what are the precautions, who are the people in whom this medication is of almost contraindicated. So of course, those patients who are allergic to this medication. Then we have got a history of drug misuse, people with history of drug abuse. This is usually contraindicated. Epilepsy, because it may increase seizure activity. Hyperthyroidism, it's contraindicated. Then cardiac or cerebrovascular disease, contraindicated in cardiac diseases like advanced arteriosclerosis, pulmonary hypertension, uncontrolled hypertension. If it's controlled, we can still try it, but uncontrolled hypertension, no. Arrhythmias and cerebrovascular disease or strokes. And because it may increase blood pressure, we have to keep an eye on the blood pressure and on the heart rate as well. So if there are any palpitations or chest pains, it should be stopped straight away. Also it cannot be combined with the medication called MAOI, which are the antidepressants. You should check with your GP. Do not use if breastfeeding. Do not use if you are pregnant. And the adverse effects are common. Adverse effects are, as I said, arrhythmias, blood pressure, tachycardia, increased heart rate, diarrhea, vomiting, headache, rash, urinary frequency, facial edema, unpleasant taste, urticaria, and impotence. So these are the common means anything more than 1%. But as I said, the absolute contraindications are if you're allergic to it, and if you develop like allergic anaphylactic reaction, or if you have chest pains, or if you have high blood pressure, like your blood pressure. If your blood pressure is controlled, it's controlled on the medications, that's fine. But if it's going up and it's giving you chest pains, headache, and increased heart rate, you should stop it straight away. We'll talk more about it in our next session. Thank you so much.